Welcome to the video blog series by Target EDAIC. Today we will be talking about all you need to know about EDAIC, covering the minimum basic information you need to know before applying for the examination. We will be covering what is EDAIC, the scope of the examination, exam logistics, your eligibility for the exam pattern and required syllabus. In the end, we welcome your feedback and any further queries which you can mention in the comment section below. So, what is EDAC? It is the end of training assessment conducted by the European Society of Anesthesiology and Intensive Care that gauges your knowledge in the respective fields against the set standards by European Board of Anesthesiologists. It is conducted in two parts, Part 1 and Part 2, that cover the basic sciences and clinical subjects relevant to the daily practice in anesthesiology and critical care. So, what is the scope of EDAC? What happens after you clear your EDAC 2? This is the most frequently asked question whenever a candidate approaches us with any query regarding the exam. Will I be able to work in the UK? Will I get a GMC registration? The answer to both is yes. You can get a GMC registration with license to practice with EDAC 2. It exempts you from FRCA 1 and you can work as an anesthetist or critical care specialist in the UK or any of the European countries, provided you clear your language proficiency examination. There is no need for a UK or European work experience before you apply for EDAC 2. Moreover, it adds a solid weightage to your CV. This course is recognized in multiple countries across the globe. That includes Singapore, Dubai, Australia, to name a few. Not only that you grab a good job offer in these countries with EDAC 2, you qualify for senior posts and better financial remunerations. Last but not the least, it is an excellent skill and knowledge polishing platform. Let's come to exam cost and logistics. EDAC 1 will cost you around €340 or $403, while EDAC 2 will cost you around €550 or $652 for the first attempt and €340 or $403 for each subsequent attempt. Part 1 is held only once a year in multiple centers around the globe around September or early October. Part 2 is conducted in multiple batches from February to December at different centers, which are more restricted than Part 1 and are mostly confined to European countries or some countries around the Europe. You should take in account this additional cost of transport and stay and give particular attention to the COVID restrictions around you. The only place to register is the ESAC website, except for candidates from Egypt, Argentina, Switzerland and Romania, which need to go through their respective national authorities. Are you eligible to sit in EDAC 1? Yes, only if you hold an acceptable MBBS degree from your parent country. Although not mandatory, the ESAC recommends minimum 3 years of anesthesiology training before attempting the EDAC Part 1. For Part 2, you must have cleared your EDAC Part 1 and have certification in anesthesia from your parent country. Applicants in final year of anesthesia training in European member states of the WHO can give the examination and present their certification later. For candidates from Pakistan, you must hold a FCPS or equivalent before you sit for EDAC. FRCA, FCAI, FCAR, CSI are exempted from EDAC 1. EDIC 1 is conducted as an MCQ-based examination with two papers that are held on the same day, Paper A and Paper B. Both have 60 MCQs each. Paper 1 focuses on physiology, pharmacology, physics, clinical measurement, and statistics. While we all have good knowledge of physiology and pharmacology, physics, clinical measurement, and statistics need special attention. Paper B, it focuses on general anesthesia, special anesthetic techniques, local, regional anesthesia, intensive care, internal medicine, and emergency medicine. Each MCQ has 5 options. Each correct entry in form of true or false carries a positive mark, and each incorrect entry is marked as null or zero. That is, there is no negative marking. So we suggest that you attempt all the questions. EDAIC 2 is viva based or oral examination. It is conducted across 4 sessions or tables, which are 25 minutes each. The first and second session is based on basic sciences, while the third and fourth session is based on clinical anesthesia. Two examiners are present on each table. A 10-minute preparatory time will be given to you with the opening question from the examiners before each session. A total of 80 marks is awarded, 20 each table. For passing, you need to score 25 out of 40 in first table, 25 out of 40 in second table, and a total of 60 out of 80. The exam syllabus is based on the postgraduate training program for anesthesiology, pain and intensive care endorsed by European Board of Anesthesiology and European Union of Medical Specialists. This is a short list of resources that may come handy in your preparation for the EDAIC examination. This list is recommended by the authors of Target EDAIC and is not officially endorsed by the ESAC. You can also download the Target EDAIC study material, which has been curated specifically for the examination. Till now, we have stats, ECG, and cardiovascular modules available for download. Soon, we will be launching our online courses for EDAIC 1 and 2. Irrespective of from where you study, we recommend that you dedicate 3 to 4 hours every day for EDAC. You should start a good 4 to 6 months before the anticipated exam date, and by the time of your examination, you should be on your third or preferably fourth revision. Persistence and perseverance are the most important allies you have in this journey. Have a request or suggestion for us, or still have a doubt surrounding EDAC? Contact us at info@targetedec.com, pay us a visit www.targetedec.com, or check out the details at the source itself, that is from the ESAC website. Your feedback and comments are most welcome in the comment section below. Thank you for watching.